Hello everyone, it's me, it's Renisha. I'm actually sitting down to do my first video. I decided to document my breast cancer journey, and part of that, I decided to do videos because when I was diagnosed, I went looking for images that looked like me, just other women that I could potentially relate to. Unfortunately, there wasn't a lot of out there. However, I did run into this one fabulous woman on YouTube, Miss Desi, and her videos inspired me, so I decided to do the same. So here we go. I guess I'll just start with the breast cancer diagnosis. On August 2nd, I was diagnosed with stage 2 breast cancer. And just to kind of just rewind a little bit and give you a little back history. So, April of 2013, I found a lump in my breast. I went to my nurse practitioner, and she said that it wasn't nothing. She said I was too young. It was more than likely some sort of breast changes, fibrocystic changes that I may be having in my breast. So she said, don't worry about it. I also had an appointment to see a gynecologist within the next 2 months, the following 2 months. So she just said to wait until I see a gynecologist to check it again and then kind of go from there. So I did just that. I went to see the gynecologist. Still, nothing had changed, and the gynecologist said the exact same thing. She didn't believe it was a big deal. Give it a couple of months, see if it changes, and if nothing happens, then they can move forward with doing additional testing. However, by this time, it was June of last year, and I was heading back to Chicago. So I was really nervous. And I put a little more pressure on my nurse practitioner and said, look, we have to do something more because I didn't want to leave with, this kind of hanging over my head. And I'm at school. I was at school in California at the time. So she and I, she sent me for a breast biopsy, which consisted of them putting a needle into your breast, a real small, fine needle into your breast. They numb the area and they take an actual sample of the lump. That happened. I left. I went to Chicago. I received a call within about a week or so asking me to come back. Unfortunately, I was, home already, so I could not do that. Um, so I just worked with my nurse practitioner, who was actually fabulous, to get a mammogram and also any additional testing that I needed. And that's exactly what I did. So I went to Mercy Hospital in Chicago. I had a core breast biopsy done. And it's a little different from that first biopsy. Actually, it's very different from that first biopsy. It's extremely painful. Probably one of the most painful things that I've ever had to endure in my life and be awake for. So what they do is they numb the actual area, and this time they put in a small camera to kind of guide their way through. So you have an ultrasound this whole time. I'm sorry, no, you're having an ultrasound so they can kind of see where this needle is going, and then once they get there, they take a chunk of the actual lump or whichever area that they're trying to sample, and that is really painful. If you can imagine someone just coming up to you and just ripping your skin off, that's exactly what it felt like. So that was completed, and on August 2nd, I was diagnosed. I was told by a resident that I had stage 2 breast cancer, and also something called DCIS, ductal carcinoma in situ, which is a grade 0, grade 1. It's a very low grade cancer, which mostly deals with calcifications. So, and that's a big difference, because most times when we think of breast cancer, we think of lumps, we think of something that you can feel, something that's palpable, and an actual breast. But DCIS is a little different, because you will not necessarily have a lump all the time. Most times it just starts with the tissue in your breast just kind of hardening up, or even your breast being enlarged. And I can honestly say, for the last 2 years, maybe 3 years, I complained to anyone who would listen to me, my doctor, my partners, that my left breast was much larger than what I was used to. And I was told over and over again that it was not a big deal. I do not have breast cancer in my family, so they didn't think that I was at a high risk of breast cancer. However, I think in those times were like a very critical moment where I should have really pushed for an actual mammogram, because the mammogram would have caught the beginning stages of the DCIS, which is, the calcifications. And I, would have been able to save my breast, but there could have been other things that I may be able to do, but I could have done anyway. But anyway, moving forward. One thing that I think is very, very, very important, but was never really spoken about, was being estrogen dominant. And that means having very high levels of estrogen in my system. And I really believe that that led to my breast cancer. That also is the main reason for my endometriosis that I suffer from. I've suffered from fibroids. I've had cysts in my ovaries. There's just been a multitude of things that I've gone through. And the estrogen is really the problem. Estrogen is really toxic. So, okay. Some of the things that high levels of estrogen kind of create are like endometriosis, fibroids, polycystic ovaries. I wrote myself a list so I wouldn't forget. Severe PMS. You can have emotional issues. And I guess I laugh when I say that, because, folks who know me know man, there are times where things can get tough emotionally. So, and I guess now I have a reason for it. Low functioning thyroid, uh, and also miscarriages before the 10th week, and cancer. It can lead to various cancers, especially with the female, with uterine cancer, ovarian cancer, breast cancer. All of these things are really important when it comes to being estrogen dominant. That's why I go on to say the importance of prevention and making sure that you are checking your breast on a monthly basis. And if you suffer from any of these estrogen dominant issues, the endometriosis, the fibroids, the polycystic ovaries, then I strongly suggest, especially if it's severe, that you start mammograms as early as maybe 28 to 30 years old, and get them on a yearly basis, maybe bi-yearly basis, because no one is really making the connection between being estrogen dominant, having these other reproductive issues, and also your increased risk of breast cancer. I would like to keep my videos kind of short, so I'm going to try to keep this one under 10 minutes. The next video will be more so like on the treatment, having a mastectomy, and all that. But before I end, I would love to just do a verbal affirmation that was given to me by a really good friend of mine. And I read it out loud every day to myself, and I would like to also include it on my videos. So here we go. At the end of this chemo journey, I will be at optimal health no matter what. And this breast cancer experience is a challenge that's catapulting me into my breakthrough. I ask the universe for forgiveness, discipline, patience, love, endurance, motivation, and to be free of fear. Breast cancer is my victory waiting to happen no matter what, because there is no other option but wellness. I set the standard for myself that wellness is the only option, and therefore it is so. All right, thank you. Look forward to the next video.